Welcome, everyone. I'm Barbara Robertson, and welcome to All Things Breastfeeding. I am a private practice IBCLC and owner of Lacta Learning Incorporated, and I'm joined here with my co-founder of Lacta Learning, Nancy Moorbacher, IBCLC extraordinaire, a little of this, a little of that, a lot of experience in a lot of areas. And today we are going to be talking about the 2022 Academy of Breastfeeding Medicine Mastitis Protocol.
Mhm.
And this came out, and not everybody embraced this, let's just say.
Mhm.
So there's been a lot of controversy. Not everybody's on the same page. So let's start out with the definition of this. And you were talking about to a different person and the definition of mastitis. And so what do you think about the definition of
Mhm.
mastitis?
Well, I had to wrestle with this with my 2020 book, Breastfeeding Answers,
Mhm.
because different people define it differently. I mean, the word mastitis itself simply means inflammation of the breast.
Mhm.
And so, do you, for example, include plug ducts in the term mastitis? In my book, I do because I believe, that there is a spectrum, and that is something that this protocol says. And that on this spectrum, that includes certainly plug ducts, what we might call, mastitis, which some people use strictly to call mastitis, which is, when you've got the feverish symptoms, the general body symptoms, as well as perhaps an area of red on the breast, pain and such. It also includes, even further along, abscess.
Mhm.
So, what you include in the spectrum, how you define the word mastitis, it really does vary among people. For example, Lisa Amir, who wrote the previous ABM protocol on mastitis, she only uses that word when someone does have these general body symptoms. She
Mhm.
does not use that word to describe plug ducts. So as a field, it's something we have not reached a general agreement on.
Absolutely. And in the protocol, they talk about inflammatory mastitis versus
Mhm.
bacterial
Right,
mastitis as well. And so that's
right.
parsing it out even more.
Right. So that would be like if maybe you do have a red streak, maybe you've got obvious, pain, but maybe you don't have the body symptoms. They would call that inflammatory mastitis.
Mhm.
Whether the body symptoms, the flu-like symptoms really are from bacteria, that's a question mark because we do have studies from Sweden, for example, that found no better outcomes when antibiotics were used or not used with mastitis. So there's a lot of question marks around this.
Well, and Pamela Douglas, when she did a review of the protocol in 2023, she
Mhm.
felt like this was actually going to increase the use of
Mhm.
antibiotics. Whereas I think all of us are hoping to decrease the use and only
Yes.
use them when necessary.
Yeah. Like Lisa Amir, who's a physician in Australia, Pamela Douglas is also an Australian physician.
Mm.
And I know Carmen Baeza from Spain also has disagreements with some aspects of the protocol, another physician.
Right. And so she in particular, um, there's a lot of talk about using probiotics and very specific probiotics for specific
Mhm.
situations. And
Mhm.
then also the use of lecithin for
Mhm.
blebs, therapeutic ultrasound for pain, probiotics for mastitis. And she feels like there's not enough evidence
Mhm.
for us to be claiming these things.
Right, right. The protocol, what I did when I got the protocol the first time was I immediately requested all of the studies that were listed, in its bibliography to look at them myself. And there were some recommendations that I felt the science was extremely thin.
Right. And that doesn't mean in the future we might have more
Right. Of
evidence.
course.
Absolutely. But right now,
Right.
it's a matter of, and then we've got to think about some lecithin, is that going to hurt anyone?
Right. Right.
Are probiotics going to hurt anyone?
Right.
And I forget what researcher, but one of the researchers said, I don't want somebody who has acute mastitis to think that taking probiotics is
Mhm.
going to take care of their problem.
Right.
So it's like this balance of There are some families that want to jump to antibiotics right away, if they have a little pain. There are other families that might be in kind of a crisis and they're like, oh, I'm going to eat some garlic and take some
Mhm.
probiotics.
It is true.
And so it's tricky.
Mhm.
And one of the issues that we've talked about is that one of the lead authors is a breast surgeon.
Right.
And so they see the zebras all the time.
Right. I personally did feel that this protocol was seen through the lens of a breast surgeon rather than someone maybe who sees more routine cases.
Right, because she talks about that I would say she would say most of these folks who have mastitis have oversupply, tremendous oversupplies,
Mhm.
that they also are suffering from many mental health concerns because of
Mhm.
their oversupply. And, as a private practice IBCLC, I would say I've seen maybe a couple of these throughout the
Mhm.
years,
Right.
but it's not, most of my folks are one-off.
Right. Right.
Like,
I think we could assume that someone who's a breast surgeon
yeah,
is going to see the worst of the worst cases.
absolutely.
Yeah.
And
So
so,
I mean, I
yeah,
don't think she's wrong about the population that she sees. I think she's probably
yeah,
right about them. But I think where I question it is is this protocol written in a way that really reflects,
mhm,
the more common experiences?
absolutely. Yeah. And again, we don't know for sure yet. Time will tell. But
Mhm.
in Nancy and I's clinical experience, we don't find
Right.
that the folks that come to us have tremendous oversupplies,
Right.
have mental health concerns. And
Right. There's
so,
a lot of
yeah.
breastfeeding mothers who, I mean, they say one in five, about 20%,
Mhm,
of lactating parents, come down with mastitis at some point.
right.
And not everyone, begins with an oversupply. Absolutely.
Yeah. So yeah, so just a lot of unanswered questions.
Mhm.
So, when you're looking at this protocol, it's what makes sense to you, what makes sense for what you're seeing in your practice, and then time will tell, and who knows? Everything in this protocol may be proven to be correct with science. But
Mhm.
yeah, we're just not entirely sure yet. So
Mhm.
let's talk about mammary dysbiosis, because that's
Okay.
these kind of ephemeral things. We're like,
Right.
"Mm,
Well, the first time I heard the term was in 2016 when it was introduced into another one of the protocols, the Academy of Breastfeeding Medicine protocol on persistent pain.
mm,
And it's a theory, from what I understand, that says that basically when the unhealthy bacteria or other organisms in the mammary gland begin to take the place of the healthy bacteria, at some point there's what they call a dysbiosis, meaning that the microbiome is put into a more negative state, one that increases the risk of pain, infection, that sort of thing. So this is a theory. The problem with it is that we don't have any way to know what, we can't measure,
mhm,
is there like a eubiosis, EU biosis, meaning good,
mhm.
good microbiome? Is it good? Is it, a dysbiosis? We don't really have any way to measure that.
Yeah. And so again, still a lot of stuff
Right.
that we're just
Question
not
marks.
sure about.
Lots of
And
question marks.
right. And in some ways, this kind of like, oh, well, that maybe would explain it. But
Mhm.
remember when we thought everything was yeast because
Right.
we didn't have enough
That's right.
information, and now
Right.
we have more information. It's like, oh, well, that's because it wasn't yeast. That's why it didn't go away.
Right.
So we want to make sure we are keeping an open mind to the
Mhm.
information that's available. Um, One of the things that we were talking about was engorgement,
Mhm.
because in this protocol, engorgement is kind of like this
Yeah.
end, and
Yeah,
then we
they
have
added
abscesses
it in this
here.
protocol. There used to be a separate protocol for engorgement. And
Mhm,
what they did is they added engorgement to this protocol. And in some ways I can understand it because many of the recommendations for treating it are similar.
mhm,
But on the other hand, I don't consider engorgement, especially that kind of engorgement some people experience right after delivery as the milk is increasing. I don't consider that part of the mastitis spectrum. So to me, that was a little bit mysterious that they decided to kind of lump it in with the other types.
Yeah, we were talking about, especially that, in the first days, it's
Mhm.
kind of like a mismanagement of the normal
Yeah,
increase of blood flow, the normal increase in
yeah,
edema. When
yeah,
nursing's not going well, this
yeah,
can end up being a problem, but it's usually easily resolved
right,
with some of as you say, the recommendations that are here.
right.
So does it belong here? Does it not? I don't know.
Yeah, that's a
Right.
judgment call, I guess.
Yeah. All right, well, let's look at some of the things that they do suggest.
Mhm,
So the measures, it says reassure mothers that many mastitis symptoms will resolve with conservative care and psychosocial support.
mhm.
It's like, okay, that's pretty reasonable. I don't
Yeah,
think.
well, I think those of us who've been in lactation for a long time know that most of these cases, that when you give them the home treatments, that
Mm,
normally they do get better rather
mhm,
than getting worse.
right. Okay, educate parents on normal breast anatomy and postpartum physiology and lactation.
Mhm,
Yes, that sounds like a solid thing. Feed the infant on demand and do not aim to empty the breast. So this
mhm,
is where it's like, well, because then this goes with the next one.
right,
Minimize breast pump usage.
right. And if you are working with someone who does have a huge oversupply,
Hmm.
perhaps those are good recommendations. But
Yeah.
if you're working with someone with just an average milk production, then that might not be good because my experience was by maybe trying to drain the affected breast a
Hmm.
little more fully and a little more often, essentially what that does is it takes a breast that maybe the milk production's reduced because of the mastitis and it brings it back up to where it was before the mastitis occurred. So I think for someone who doesn't have an oversupply, I do question that recommendation.
Well, and again, in my private practice, the same thing.
Mhm,
And I will point out that, they have the level of evidence for these things, A being the highest level of evidence, and I
mhm,
think E,
mhm.
no evidence, and it's C,
Right,
C, C. And so
right,
all of these things are C.
right.
And yeah, it's just again, and it goes against what I have found in my clinical
Yeah,
practice.
I think again, it has to do with your assumptions about who is getting mastitis.
Hmm.
Because again, if you're only seeing people with oversupply,
Hmm.
then that would make a lot of sense. But if the women you're seeing with mastitis do not have oversupply,
Right.
they could end up with reduced milk production as a result.
Well, so I think we have to think about each situation. All right, avoid the use of nipple
Mhm.
shields. I mean, nipple shields are not going to be the answer probably to
Right,
mastitis.
right,
Um, wear an appropriate fitting supportive bra. Again, these are all C.
right.
Now
Well, one
this,
thing one thing I find interesting about that one is that, it used to be we would say, what are the causes?
Mhm,
And one of the causes was if anything was putting consistent pressure on any area of the breast. And I don't see that in this protocol as
mm,
a possible cause. I mean, I remember when my youngest was a newborn and he and I were doing something that's not recommended today. We were taking a nap on the couch and his chin was resting on my breast. And that I don't know how long we were sleeping, but when he woke up, I felt like I had a plug there now. And so, I mean, I had that personal experience. I've seen it many times where an ill-fitting bra, or maybe, somebody who wears a strap across their breast that's
mhm.
putting pressure can cause this problem. But I don't see that reflected anywhere in the protocol.
Yeah, or when you have somebody who comes in and they're putting pressure, like they're
Mhm.
holding the breast and they're like, I was getting plugs right back here, and you're like,
Right.
well, yeah.
Yeah. Yeah.
So it is interesting that which seems like a common reason that we were
Right.
seeing is not
Right.
here.
And another thing that they basically say in the protocol, which surprised me, is they did not want to draw any connections between having nipple damage and mastitis,
Mhm.
which I know from looking at the literature, and I heard Lisa Amir talk about this in her talk recently. Literally every study on incidence of mastitis, there is an association between nipple damage and increased risk of mastitis. So for some reason, the authors of this protocol don't want to draw that connection, but
They
it
haven't,
definitely
yeah.
is there in the literature.
Yeah. Well, and there's a couple more things again in here. It says avoid deep massage on the lactating
Right,
breast. This we have level B of evidence, and I think
right.
you and I would absolutely agree.
Yes. Yeah, because often what happens with massage is if a mother thinks that a little massage is good, she may come to the conclusion that a lot of massage may be better. And
Yeah.
what Dr. Mitchell, who's the lead author on this study, noted is that many of the women she saw for breast surgery were women who had damaged their breasts from too vigorous massage. So I think, yes, we could definitely agree that too vigorous massage is not a good thing.
Yeah, too vigorous deep massage can actually cause inflammation, which can
Yes,
lead to more plugged ducts and mastitis.
right,
And I think it's this misunderstanding that we have to push something out of our breast
right.
versus the ducts are being compressed by
Right. And
inflammation.
I think that's one of the new ideas in this
Mm,
protocol that's actually really valuable. The fact that it's
fabulous.
not something in the duct that's necessarily causing the restricted milk flow. It is pressure from outside the duct, the inflammation in the breast tissue that's pressing on the duct and restricting the milk flow.
Yeah, absolutely. It says avoid saline soaks, castor oil, and other topical products. Level of evidence is C, but it's something I haven't been doing that for years.
Yeah,
Avoiding, I mean, suggesting those things.
yeah.
Avoid routine sterilization of pumps and household items. This is
Hmm.
where that like, yes, I don't think we need to get crazy with hygiene, but when I have families with cracked and bleeding nipples, washing with soap and water is
Uh-huh.
once or twice a day is actually supported by the literature.
It is, yes.
Yeah, and so it's like, oh, on the, so it's tricky. And then they have, so then this is kind of the summation of their medical interventions. Decrease inflammation and pain.
Hmm.
Yes, and we do that through gentle touch, like sorry, what is that called? Lymphatic
Lymphatic
drainage.
drainage.
Yeah,
Right.
maybe some over the counter like ibuprofen or Tylenol if that's safe for them to take.
Mhm.
Ice versus,
Right, using cold versus heat.
and that's another one where like, yay, thank
Yeah,
you. That's a great idea.
because too much heat can obviously increase inflammation, so that is not a good strategy.
Treat associated blebs and avoid unroofing. So we used to just say, oh, scrape off that skin and have things come out of there. But they're like, don't do that. Instead, use a
Mhm,
steroid cream.
mhm.
And it's like, okay, haven't had enough blebs to
Yeah,
play with to
well, it's
know.
interesting because that's based on one abstract from a breastfeeding medicine doctor in Seattle who did that with 5 patients.
Mm.
And the thing that set them apart was these were all patients that had what she called dry blebs, meaning that when she tried to like open it up and get milk flowing,
Oh,
nothing came out. But I
mm,
think you and I both know that not everyone has dry blebs.
yeah.
So again, this is the sort of recommendation. It's like, all right, well, that seems to make sense for a certain limited number of people, but is this a good overall recommendation? And I don't really know the
Right.
answer to that. Blebs is one of those things we have so little research on.
We really, because
So
I I
it's
feel
tough.
like there's like at least five different kinds, if not
Uh-huh.
more, just the way they present themselves.
Hmm.
All right, decrease any hyperlactation. Sure, we
Right. We're on board with that, definitely.
utilize therapeutic ultrasound is one of their medical interventions they suggest.
Uh-huh.
And I have had clients use medical ultrasound and it
Hmm.
has helped them,
Uh-huh.
but do we have the evidence? We're having more
Yeah.
and more evidence.
Yeah,
Absolutely.
well, hopefully that's something we'll hopefully get more evidence about. But yeah, I'd say that's another question mark at this point.
Yeah. And then consider probiotics. Again,
Right.
they have to be the right ones though. You can't
Right. Just
just
any
any.
probiotic off the shelf is not going to be helpful. There are specific strains of bacteria that are associated with a healthy mammary microbiome. And there is a group of researchers in Spain who began the research on this. The issue that some people have with it is that these same group of researchers also own the patent on
Mm,
these bacteria. And so therefore they earn profits from their sales. And there have been some questions about some of the research. I heard Lisa Meir talk about this in her recent presentation for the International Lactation Consultant Association Global Study Day. And, she wrote to the researchers because she felt some information was missing. And then she also looked into it further and felt that the actual nature of some of these studies was misrepresented. So there are definitely questions around some of these studies. And I know Dr. Carmen Baeza also questions them. She lives in their area, so she probably knows more than the rest of us. But, it's personally, I would be much happier if we could use probiotics as opposed to antibiotics
Mhm.
for mastitis. But, I don't want to come out in favor of a treatment until we have enough evidence to
Right.
support that it's going to be helpful. Because, it's true, it's probably not going to hurt anybody, which is good. But, we don't want our families wasting their money on something that's not
Right.
really going to help them either.
Yeah. Yeah, and so in 2023, there was a study by Ho who had 285 women, and he did find that it was very helpful.
Mhm.
In 2020, we had another one, and so it's like there's some evidence is coming.
That's good. That's very good,
Yeah,
especially if it's not the same researchers that own the patent. That
right.
would make me
Well,
happy
right, because that's
also.
ultrasound, so that's a little
Yeah,
different.
yeah.
But yeah, then we have some probiotics. There's a study from 2014 and 2010, and it's Lactobacillus fermentum and
Right, right. That's one of the
Lactobacillus
strains. Mhm.
salivarius. And so yeah, so there, which again, just don't quite have the evidence, and we don't want somebody just taking a probiotic when they perhaps need more
Oh,
treatment.
right, to just go like to their drugstore and pick any probiotic, that's not gonna help them. We
Exactly,
can
and
say that for sure.
we know that that's what people they all they hear
Mhm.
is probiotic prevents
Right,
mastitis, and they think that they have an answer.
right.
Well, we do feel like there's some wonderful things about this protocol. The fact that we are using gentle touch now, that we
Mhm,
are using ice, that we're
mhm.
thinking
Both. Mhm.
about that it's compressing the ducts, not a piece of something. But
Right,
then, and the others, we're not saying no, we're not saying, we just saying we don't have enough evidence.
right.
We,
Question marks. We have
yeah,
questions. Yeah.
but hopefully they're going to continue to be studied, and we will check it out. But yeah, if you haven't looked at the 2022 protocol, check it out, see what you think about it. It does have a lot of really good information in it.
Mhm,
Also think about, are wondering if we're viewing things through a certain lens that
mhm,
sees things a little differently than we do in just our daily private practices.
mhm.
Um, yeah. Well, thank you for joining us, Nancy. This was a
You're welcome.
fabulous discussion. And thank you for listening and watching. If you have enjoyed our podcast, please leave us a review. You can find more podcasts on Lacta Learning Inc. or your favorite podcast listening device. And yeah, we're getting close to 100 podcasts, Nancy. So we've been
Mm,
doing this for a while.
it's
But
great.
thanks everybody for joining us. We
Yeah.
appreciate your listening.